video is going to be looking at sleep for your baby, and we're going to be focusing on safety issues. So in the UK, the current guidelines are that your new baby sleeps in the same bedroom as its parents for the first 6 months of its life. This is because we know that the likelihood of a baby suffering from a cot death, which by definition is an unknown cause of death, is most likely to happen in the first 6 months, and we know that cot death rates are greatly reduced if the baby shares their parents' bedroom. Beyond 6 months the rates reduce, and by a year cot death is very rare indeed. So having your baby in your room but in their own cot or crib or Moses basket is considered to be the safest way to have them sleeping. The reason why having them in your room reduces the rate of cot death is because for some babies, learning to breathe is a new skill once they've been born, and they may forget to do this. However, if they are in a room with their parents' carbon dioxide as their parents breathe out, this triggers something in their mind to help them remember to breathe in, so they're less likely to forget. Also, if the parents are in the room with them and they notice that their baby has stopped breathing, they can respond much more quickly than if their baby is in another room, thereby gaining precious seconds to save their baby's life. When you put your baby down to bed, whether it's in your room when they're little or in their own room when they're older, it's important to put them so that their feet are at the foot of their cot, and this helps prevent them from wriggling down under the covers. It's also important not to give them a pillow or a duvet until they are at least a year old, as these can cause risks of suffocation. And to have the room not too warm. So the average recommended temperature is about 18 degrees Celsius, which for some people is cooler than they would be used to. And if this is the situation for you, then the recommendation is just to put an extra blanket on your baby until they are warm enough. You can also use a baby sleeping bag once your baby is a sufficient weight for that to be a safe option. Some parents also like to have their baby in bed with them. If either you or your partner is a smoker, then it is not a good idea to bring your baby into bed, as we know that smoking greatly increases the risk of cot death. Likewise, if you or your partner have been drinking or taking drugs, whether recreational or prescribed, if they're going to affect your ability to respond to your baby and make you very sleepy, then it's not sensible to have the baby in bed with you. Or if you're exceptionally tired or unwell yourself, then you may not be quite so responsive. So again, perhaps safer not to have the baby in bed with you. We know that more women bring babies into bed than anticipate they're going to when they're pregnant. It may only be once or twice, just because they're so tired from sitting up and feeding so frequently through the night that they just want to have that ease of feeding, particularly if they're breastfeeding. It's not recommended to share a bed with your baby if you are formula feeding, because we know that formula feeding mums tend to be a little bit less responsive in the night time to their babies on an instinctive level than breastfeeding mums do, which may put their baby at greater risk if they're in bed with them. So keeping your baby safe whilst they're asleep is best done when they're in your room, but ideally not in your bed, unless you are not a smoker and haven't been drinking or taking drugs or giving your baby formula milk.